The following materials are prepared: non-sterile gloves, a tourniquet, the required laboratory blood sample tubes, a needle holder, a needle, a band-aid, and alcohol cotton swabs. Note that povidone iodine should not be used for blood samples, since contamination with iodine may cause erroneous results, such as raised potassium levels. The patient and healthcare provider are seated, and the arm is placed in an extended and supinated position for access to the cubital fossa. A pillow or rolled-up towel may be placed under the arm to keep it in a relaxed and supported extended position. Extending the arm will bring the veins to the surface and make them more visible. However, they are best identified by palpation. Many anatomical variations of the veins are possible. Generally, the median cubital vein is easily identified and accessed. The basilic vein crosses the median nerve and brachial artery, increasing the risk of injuring these structures. The veins are occluded by applying a tourniquet 7 to 10 centimeters proximal to the venipuncture site. To prevent the skin from getting caught in the tourniquet, a finger is kept behind the catch while it is tightened. The patient may be asked to clench the fist to make the veins more visible. On palpation, the veins are recognizable by their spongy firmness and roll away easily, while arteries pulsate and are more fixed. Take note that prolonged fist clenching and occlusion of the veins may cause hemolysis. After disinfecting the hands, the non-sterile gloves are put on. The cubital fossa is disinfected using an alcohol swab, starting at the center and working outwards. The needle is placed in the needle holder, and the cap is removed. Using the thumb of the non-dominant hand, pressure is applied to the vein distal to the venipuncture site in order to stabilize it. Care should be taken not to touch the venipuncture site, as this will require repeated disinfection. Aiming at an angle of 30 degrees or less, the needle is inserted into the vein. The blood sample is collected by inserting the vacuum laboratory tube into the needle holder, driving the needle through the cap of the tube. As soon as a good blood flow is seen, the tourniquet is released. When the required blood samples have been taken, the needle is gently removed and pressure directly applied to the puncture site using a clean cotton swab. Care should be taken to always release the tourniquet before removing the needle, to prevent bleeding from the puncture site or hematoma formation. The patient may be asked to hold the cotton swab in place while the needles are safely disposed of. Local protocols should be consulted to see how many times the different types of laboratory tubes should be inverted for optimal mixing of any additives. Care should be taken not to shake the tubes, since this will cause hemolysis. Finally, a band-aid is placed on the puncture site.